Hello guys, we are live today for session number 28 of Carnivore Team GB to get all your Carnivore Diet questions answered today for up to 1 whole hour only. So today we're going to be talking about nutritional testing and deficiencies on the Carnivore Diet. So we get a lot of questions in consultations, chats, YouTube comment sections about, am I deficient in fibre? Am I deficient in this, that and the other? We're not going into this. This will not be a talk about how we don't need fibre and we don't need extra vitamin C and all this sort of thing. This will talk specifically about testing. So only about testing. We're not going around the Rob Roses talking about how we're going to be, deficient in vitamin C. We're not going through the food guidelines. It's only about testing. So we're talking about hair analysis. We're talking about blood analysis, phlebotomy, any other sort of test that you could think of, that I've not thought of outside of that sort of little box there. I'm just going to give it over to Coach Stephen. That's right, because it is probably his area of a bit more expertise for sure, being that he has been a phlebotomist for quite a while, and he understands blood testing results probably a bit better than most of us, I imagine. Well, hopefully so, anyway, because we're a bit limited, I'm guessing. But yeah, take it away, Stephen. What's been your take on different tests? What you found most useful? Perhaps give us a little explanation of what you find you frequently test for. Any deficiencies you might have come across on a keto, low carb, or carnivore diet. What has been most impactful for you in your practice?
Right, that's a big remit, but that's what we're doing tonight. So yeah, I mean, if you're looking for nutrition deficiencies, the best way to assess them, or the most common way, that's probably a better way of putting it, is blood tests. And to answer your question, what are the most common ones that come up? Well, vitamin D. There's a big surprise. Most people are worried about vitamin D, but there's quite a lot to talk about vitamin D. I don't want to get into the weeds straight away, so let's just introduce the subject. Vitamin B12, iron, and calcium. And the thing is, there's a lot of misconceptions about those four things for a start. For instance, you can have great levels of vitamin B12, but it doesn't necessarily mean it's been synthesized properly in the tissue. So you can have other tests. So you could find an absolute level in your serum and think, well, this looks fine. And iron is another one, for instance. So people look at serum iron, but it doesn't give you the whole story. So I sort of went off the B12 there. So you can do a separate test for B12, melamelonic acid, which actually shows you what's happening with B12, not just in the blood, but in the tissue. And the same with iron. You might find that your serum iron is perfectly fine. And this is the biggest thing about this subject, is where your bloods look fine and you don't, or you don't look fine and your bloods do, however you want to look at it. So iron, for instance, it can be misread. So people can say you've got an iron problem because your ferritin is high. Well, okay, have you got any symptoms of an iron overload? And secondly, that's not the best way to test it, because ferritin is what's called an acute phase reactant. It could be stopping iron getting into the bloodstream because you've got an infection. A low-level pathogen will need iron to live. So ferritin goes up because your body's doing the right thing. So that's another thing. So when people are talking about iron, you can measure it in the blood, but then there's like 4 or 5 tests you can do alongside it as well. Shane Rich is not here because calcium is one of his big topics. He feels that we're too obsessed with levels of calcium. And of course, people worry about calcium because of bone density or osteoporosis. Many times when I speak to someone, it's not the calcium level. It's actually a lack of other nutrients, or they're not doing resistance training, or they're not moving at all. So why would your bones get stronger? Because your bones are breaking down and rebuilding all the time. In fact, if you go in, we're talking nutritional testing, so this isn't too far of a stretch. Even when you get into stable isotope testing, so you're looking at what people ate and what were their nutritional deficiencies 100,000 years ago, 200,000 years, 400,000 years ago. The way that bones break down and rebuild is actually one of the key factors that helps us know the area and the era and how old that person was, and then what they ate. Because you can say, right, well, this long bone was definitely, it's got a 10-year lifespan. So we know that. And so we know what they ate for 10 years. We know that from the stable isotope testing. So bloods are good. But I think people worry about the numbers too much and not about the symptoms, how they present. And that is, to me, actually, when you look at this online, it will say bloods first, symptoms second. And that is absolutely wrong. Because, as I say, especially with this way of eating, you can be in a situation where you're thriving, but your bloods allegedly tell you that you're not. So if you've got symptoms of anemia, bleeding gums, for instance, that might be a good one, pale skin, you could do a blood test to confirm that, but nothing says it more than looking at you or that thing happening. So if you've got people coming in with extreme fatigue, right, maybe that's iron, maybe it's zinc, maybe it's other things, weakness, shortness of breath. There are lots and lots of things that you can test for, but those three symptoms there just mentioned, the first thing is, right, we'll look at your iron levels. If someone says, well, actually my pains are in my bones, then you do a vitamin D test. That would be the first port of call. Now, I'm just going in what looks like the standard duty of care is when you're in the role of phlebotomist and you're carrying it out on the mainstream. They're not bad things, actually, to look at, even with this way of eating. So I think those two things are pretty good. So your blood tests and symptoms, that way round is right. So symptoms first, blood tests are second for your nutritional deficiencies. Thirdly is then, and Phil will definitely sort of get into this as well, I think, is you could be eating plenty of stuff, but if you're not absorbing it, then you're not making the most of your nutrition. And of course, some of that can end up, in the toilet. So your gut health will also be a factor, because people will say, well, I can't be low on B12 because I'm eating ribeyes every day. A silly example, but you would imagine that they wouldn't be short on B12. Well, then you can go, well, hang on a minute, we can definitely look at the fact that maybe it's not been absorbed. So that's why I mentioned at the beginning of it that we can do another test to see what's happening to the B12 that you're eating, whether it's getting to the tissues or not. You mentioned hair analysis. For me, I'm not overly a fan of hair analysis. I think it has a little place. It's very cheap. It's very easy to do. Don't forget, a blood test is a snapshot from that day. So there's the limitations with bloods. Hair analysis is a snapshot from a long time ago, maybe like 3 months, over the last 3 months. So I would prefer, if someone was doing that, to do that over a period of time to see if there's any trends. With the bloods, exactly the same thing, but I think you get a better reading from bloods. And of course, you can do other things. You can do urine analysis. Urine analysis is very good for clearance of organs. For instance, the easiest one to talk about, obviously, is kidneys. You can see what's going on, what's being passed into the urea. And obviously, again, with this way of eating, you have slightly higher levels of urea, because urea mainly takes out the metabolism of the waste products from protein. So you get urea, creatinine, that sort of thing. So when you do urine tests, it's very good for what you're wasting. So one of the disadvantages of ketone testing, for instance, to see if the nutrition you're getting in is getting you to be fat adapted, for instance, well, that's still a wasting process. So ketones, again, going back to bloods, are probably better in your bloods, and same with glucose, rather than looking at urine. But we should mention it because it's there. And obviously, alpha diversity testing, if you want to test your microbiome, basically you get a little sort of paper hammock that goes across the toilet bowl, and you do your number twos, and then you have a little thing, a little plastic thing. You get gloves, by the way, don't worry about that. And you take your sample, you send it off, and lo and behold, about a week, 2 weeks later, your gut microbiome results come in. You can also test your omega-3 in many different ways. You can do dry blood tests and all that. What's that got to do with nutrition? Well, that's obviously related to things like omega-3s from fats, fatty fish, and that sort of thing. Now, they all have the problem that the results are still in line with what the mainstream thinks are good, bad, indifferent, high, low, whatever. So for instance, omega-3 testing can sometimes give you a bad result, because a lot of the behind the scenes calculations are looking at omega-3 in relation to saturated fat. Now, obviously, if you eat this way, you're going to have more saturated fat, and therefore your ratio is going to be thrown out, and they're going to say to you, wow, your omega-3, you need to eat more fish. Basically, the really simple sort of report comes out. And by the way, I don't look yellow. I don't know what's happened with the lighting. I haven't got jaundice, which you can test for, by the way. But anyway, so there's many different ways of testing for nutritional deficiencies, but it isn't as simple as saying, right, I want to find out why I've got fatigue, test my iron. Oh, there it is in the serum. Because food isn't just about the input into your mouth, it's how well does your body deal with it, how does it get absorbed, what's escaping through the small intestine. So yeah, lots of different tests. Hopefully that was the sort of introduction you wanted.
Yeah, perfect. It makes brilliant sense, and it kind of matches my personal experience as well in regards to hair mineral analysis testing. I personally wouldn't look there because there's too much wrong with it. A bit like the HbA1c thing, you know, it sort of gives you a snapshot of what's happened over the past 3 months. Or what did you do the last month? Have you had an inconsistent intervention with your diet or exercise or lifestyle regime? In which case, that doesn't really hold true to what you've done over the last 3 months. It's maybe the last month that you've had symptomatic relief or not relief from that past month. Obviously, hair grows in 3 different phases: anaphase, telophase, and cataphase, I believe, something, or around the other order maybe. Each phase lasts something like 4 to 6 weeks. So, you know, hair growth, if you're testing a bit of hair, it could have all different parts of what you've been doing over the last 3 months to give you an idea of what's been happening, which could be anything. So unless you're cruising solidly and you've been doing a diet like Lee or Phil or one of us has been doing the same sort of thing day in, day out, you're not going to get a real accurate picture of whether your intervention has been effective or not. I think the only test I can really speak of doing other than blood tests, which I have very frequently, well, for me, compared to most bodybuilders, I have 3 blood tests per year. Pretty much the whole shebang, everything that's relevant to sports performance, athletic endeavours for men. And I find them quite helpful. Inflammation I keep an eye on, CRP, HbA1c I usually get tested, liver, kidney values, things like that, maybe a few vitamins and minerals here and there. But one thing I did actually do yesterday, and I told Richard about this, the Keto Pro, is I did a ketone test, a urine ketone test, just to see what would happen. I know the limitations of that as well as anyone else, so it's purely a speculation just to see what was going to happen. My ketone level reading on my high protein, low fat, protein poisoning, protein sparing modified fast, which we've been doing for 3 months basically, has resulted in me having a ketone level of exactly the same as it always is, which is about 0.5. So a level of ketosis, but not strong at all in my at least urine sample. So there we have it. If I did a blood test, it could be different. If I'm exercising, not exercising, that could be different as well. So yeah, that's pretty much my limited experience in testing personally. I've had the same experience as Coach Stephen actually in terms of what my different clients have had done. Thyroid markers get tested quite a lot. I do work with quite a few women at the moment, so they're getting those sort of things tested frequently as well. Just wondering if we go around the panel as we see it in clockwise order. Perhaps we'll start with Ben. If you've noticed anything about different blood tests you may or may not have had, then also the same question goes to Phil and Lee.
No, really nothing to add. I've only had 1 blood test in the last however long, which was to do with inflammation on my foot, and I didn't get all the results, so no, nothing. Not my area.
Blood tests for me, well, I really don't bother. I did one time when the vegan said that I was going to die of diabetes or whatever, like Sean Baker, and so I had them done and everything was fine except LDL up a bit, which is just where I wanted it, and even the liver function was fine, whereas it was horrendous when I was veggie. So I not really. When I got really sick, like in winter of 2022, I had some done and sent them off to Sophia. And it was funny, she just throws them out and goes, that one's useless. That doesn't mean anything, this and that, and the docs were going over here. They were going, you got cancer and all that. But I was really only interested in CRP, and that was horrific, as I expected. But no, not a great blood tester. I can go for that first question that Andy asked, but let's go around anyway. Lee, how about you? Blood tests?
Well, I wouldn't have bothered, except for I've had 3 pre-operation assessments over the last, whatever it's been, 19 months or something, in which I've just been challenged a little bit about my cholesterol. But your cholesterol looks to be very high. Didn't tell me exactly what it was or anything like that. Similar sort of thing, high LDL. Just explain to them, this is my diet, this is what I'm doing. It works for me. I feel healthier and better than ever. And so, yeah, I haven't actually seen any real results. I'm not really interested to go and get anything tested because I feel good. I agree with Coach Stephen. I think symptoms come first. If you've got no issues, there's no point in trying to find a problem that's probably not there. And I think if you know what you're doing, you know what you're eating, and it's actual food, and you're living a proper lifestyle, as best as you can in this modern world, then I think it's not really an issue. If you feel good, you're getting out and about decent amount, you're moving, and you're eating lots of animal fats and proteins. I can't see why you'd really have an issue unless you just sort of, converted overnight from a very different diet where perhaps your bile production needs to adjust and different things like that. Maybe you've damaged your kidney function, you damaged your liver function, and then there may be some issues pertaining to the old diet. It always seems to be this exposing the weaknesses with the old diet when people go carnivore and they have issues. So I think, if you've been at it for a while and you transition slowly and you're patient, there's really no real need unless you've got symptoms, and then perhaps, have a look into some things. But like we're saying, these figures, these numbers that we get back, they're very much arbitrary and pertain to the average sick person. So that's my
I'd like to. Yeah, Lee, firstly, it's great to have you back, and seeing you with your clothes on is really good. So I didn't recognize you, the old joke. Anyway, Jonathan mentioned one there, the HbA1c, which is really problematic in so many different ways. It's unbelievable. So I suppose one of the things that came out of the PHC conference, so just to rub it in for Lee and Phil at the moment, when you look at something that's an average, if your blood levels are, let's help the Americans here, let's say it's 90, your average is 90. Well, you can also have an average of 90 if it's 180 and 0, 180 and 0, 180 and 0, 180 and 0. I mean, just using that as a stupid example, you could say your blood glucose was an average of 90, but you had 6 or 7 peaks there at 180, which are really destructive. So that's the first thing. Secondly, with the HbA1c, it's not a direct reading. So we're talking about nutritional deficiencies, or we're talking about nutritional testing. So the HbA1c is an alleged test of your carbohydrate or glucose metabolism, and it doesn't do anything of the sort. I mean, so what will happen with the HbA1c is they immediately make an assumption how long your red blood cells will last. And sorry to just go over this, but you do need the detail. When I qualified as a phlebotomist, one of the things you were told was to ignore the HbA1c if someone was hemolytic anemic. All that is saying is their red blood cells die really quick, which is partly why they're anemic, because they don't have enough red blood cell production to service them. So artificially low HbA1c, red blood cells, they're not lasting very long. So it doesn't take a rocket scientist to think, well, what about an artificially high HbA1c? Does that mean that the red blood cells are living longer? And there is a test to prove that. So I have many people come to me, I mean, obviously, because I sort of do the obesity and diabetes thing, and they will say, I don't really understand. I am doing my continual glucose monitor, and these figures are fantastic. So that's actually coming from my body on an average sort of minute by minute basis. So that average is really great. And also I'm doing my finger prick test, which is actually glucose in my actual blood, and that looks really good. I've just had some labs, and my fasting insulin is really good. My C-peptide, that's really good as well. My fasted glucose is really good, but my HbA1c has gone up. Well, that's because it's a calculation based on red blood cells lasting for whatever lab wants to do, so like 120 days or 90 days, and it will give you this false reading if your red blood cells are living longer. So there is a test you can do, which is called the reticulocyte count, and that will tell you the production from the bone marrow of red blood cells, and will actually say to you, your red blood cells are living longer. So therefore you get this artificial HbA1c, and this is the sort of nuance that isn't discussed enough. So it is nice to do this, Jonathan, and talk about this subject. Tests aren't the be all and end all, and that's why both EGFR and some labs now have dropped the little e, which is awful, because it is actually telling you estimated filtration rate, and the HbA1c is not a direct reading. There's also the big one, the elephant in the room, LDL. Is not a direct reading. That's a calculation as well. So all these things that are used to sort of scare you or get you onto meds and stuff, they're very easily manipulated to the outcome that they sort of want you to adhere to. So don't forget, all these ranges are based on people in general eating 60% carbohydrates, and they're not ranges for optimal fitness. So it's just averages. So again, going back to the sort of average thing that I showed you, averages don't mean that much really compared to sort of direct readings. And I'm glad to hear everyone else seem to agree that symptoms actually are the lead. And yeah, I'm a phlebotomist, but I haven't done my bloods. You know, I gave up because I just felt, do I really need to do it? The only time I've ever done it now, and that's included glucose and ketone testing, is if I've got a YouTube video to make, and I think some people might be interested in the data. But, 10 years not going to the doctor, 10 years without a day off. Why do I need to do some blood tests? What, to check that I'm going to be all right tomorrow? I don't think so. But anyway, there is a place for testing, but if you're feeling good, I wouldn't sweat over the numbers.
Good shout. Yeah, I think we can all test for the same thing there. Completely agree. We're going to move swiftly on to the questions that we do have, because we do have a lot piling in. I'm going to do my best to direct each question towards 2 people. So we'll have 2 people answering each question, so we can actually get through them succinctly. So we're not just repeating the same, stuff. As good as what we say is sometimes, as good as what I say is very occasionally, but on the odd question here, we've got one from Andy, which I think Phil wants to answer. I'll also pass this one over to Ben as well. So Phil and Ben, if you have a go at this one.
Cool. Yeah. Hi, Andy. I saw you asking how to ask the questions earlier on. If you've got autoimmune issues, I really wouldn't worry about anything except healing the gut to start with, because like Stephen says, if you don't have the gut healed, you're not going to be absorbing stuff anyway. And if it's at some sort of acute phase, yes, even the egg yolks will do something. I don't know I never had any kind of a reaction to fish and liver, but it's, according to paleomedicina, it's great to get the liver in, because that's like kind of a vitamin pill, really. And if you can, just maybe have a little bit every day. The recommendation is only about 400 grams a week. So it doesn't take much. It's only like a big bite a day. But do you need to supplement? I really don't think so at this stage, because a lot of the supplements can contain fillers and all kinds of things that keep the gut leaky. And if you're not absorbing properly, you're not going to be absorbing them from the supplements. So you said specifically iodine, and I wonder, I wish we could kind of chat and find out why it is that you think you might be deficient in iodine. I mean, a lot of people are, but would a little bit of Lugol's iodine keep the gut leaky? Maybe not. But I would say get completely symptom-free before you start to address anything really with supplements. And then know exactly why you're doing those supplements if you need to, because don't be one of those people who goes down to Holland and Barrett and fills a trolley. You'll only throw them away in 3 years when they go out of date. So find out from somebody, get on to Stephen or something, get the blood tests interpreted and properly, and find out what you actually need. But iodine supplementation, it's absolutely fine, but unless you know that you need it, I wouldn't really put that anywhere near as important as healing up the gut. That's me.
Yeah, nothing to add. You could try eating oysters and see it. That's another good way to get minerals and iodine and stuff in there. But you might not like them, or they might not like you.
And if you're having any issues still, and you're saying that you don't talk about the fat levels you're having, I think something really important for healing the gut is to get those fat levels up. People can have all sorts of reactions if they're eating too much protein, or protein, as Sophie calls it. So, that shows up in the blood tests, and just make sure you're getting like 1/3 fat to 2/3 lean meat on the plate by sight, which is the easiest way to do it if you're fixing the gut. Really important.
Nice one. Got a super chat from Ben, and he's asked, has a carnivore diet affected your thyroid? It's on my channel, sent to me. So I'll say no, I didn't have any change at all in my thyroid levels. Also asked one, just to Lee quickly, have you had thyroid levels checked, and if so, was there any deviation since starting the carnivore diet? You're muted. You're still muted.
Yeah, no testing or anything like that. I haven't experienced any problems. I would assume, if anything, it's probably improved because I think I'm getting more sort of iodine and selenium and minerals and nutrients like that, more so on this diet that I'm on, eating egg yolks, beef and seafood and things like that, where I was eating a lot of things that would interfere perhaps with absorption and not having enough protein and different things like that. So,
Sure. Okay, we've got a question here from We Are All One. I'll ask this one probably because the most relevant perhaps to Lee and Phil, two people that have potentially struggled to lose weight because of different health issues they've had. Is there any input towards what this person's dealing with? They can't stop losing weight on a carnivore diet. Like, do they need to bite the bullet and just say, I need to stuff my face? Do they listen to their body? What would be your best practice, Phil and Lee?
For me, there's twice I've lost enormous amounts of weight, and it can be times of inflammation, or it can just be as simple as the fact that you're losing a load of fat. Depends what the weight is. If you're sick and got high inflammation, you can lose a load of muscle mass. But if you're not sick and you're losing it, it's probably just fat that you're losing. And it can be alarming when you lose that fat and realize how little muscle you actually had underneath. A lot of people don't realize that they're not quite as muscly as they thought. But if it's anything to do with inflammation, both Natasha Campbell-McBride and Sophia Clements have said that, and I've experienced it twice, with no change in diet, suddenly the weight comes back on again. I've been stuck around 125 pounds sometimes at 5'10", which was horrific, twice, and once for about a year. And you find that the weight comes back on. I kind of didn't believe them, and you get that panic. Should I be eating a load of sweet potatoes? Should I do that? But do you want to just put fat back on? There's not much point. If you're committed to carnivore, then it's just a matter of training. Go out, if you're not got any inflammation, go out and train, put some muscle on, the weight will come back on then, and it'll be good weight, not just the fat. But if you're fixing something in the gut, it really is true that it's almost like the gut seals up and suddenly the scales start coming up again. I've experienced this twice, and they're absolutely right. In fact, when paleomedicina do these consults, particularly when my missus had Graves' disease and she was getting really skinny and I was worried, and she was putting her weight into Sophia every day or every couple of days or something. And Sophia kept saying, not light enough yet, not light enough yet. Almost like, you got to go through that process. And it worked in the end. She came through the other side and the weight came back on. So I wouldn't worry about it. But if you're healthy and no problems, but just losing weight, it's probably fat. Get in the gym and do some resistance training. Lee?
Honestly, you pretty much covered everything I was going to say. I think most likely you're going to go through this phase, and then your body, once it's right, once it's healed, once it's happy, you're either going to maintain what you may feel like is underweight for you. Like, I actually discovered a similar thing. I was losing weight quite rapidly, though I felt really good after 3 weeks, and I continued to lose a little bit of weight. And I'm only 5'6", and I look pretty small. A lot of people comment actually about it on a lot of my videos. Oh, you should do this, you should do that. But I actually feel great, And I think when I take my clothes off, I look in the mirror and I think I look healthy. I've got a reasonably healthy composition. And I think we're so used to and conditioned to seeing all these overweight people, right? People that even that to them, they might not think they're significantly overweight, but they are. They're carrying this very sort of luxury like fat. We wouldn't be able to just walk around all fat as we want, with access to carbohydrates to be able to activate Randall cycle 24/7 all of the time. So I think it's true. If you feel good, I wouldn't worry. Don't stress out about it. The only thing I would add, other than definitely move and be physical, you want to use your muscles, because that's one way to get rid of them. When I fasted for 5 days, I was quite physical. I only lost a few pounds in weight, but in 1 week of having the surgery, where I was just laid out in the bed, I lost a stone, 14 pound, like that. So it goes to show, you want to continue to move. You want to be physical. You want to lift what you can bear, sensibly and responsibly. The only thing I would add is maximize your circadian rhythm. I think hormones, they play a huge role as well. And you're not going to garner the maximum positive effects just from diet alone. Get your light exposure at the right times. If you can, I know it's tough sometimes with, different work situations. Get out and just have a look at the sunrise and just look towards the east as the sun rises. For me, it's a game changer in my mood. It's like a free dopamine fix. I'm in the best mood ever after I watch the sunrise. Yeah, and I feel great. And when that sun goes down, if you can, again, blue blocking glasses, dim your screens. There's different sort of apps and things like that you can do to maximize avoiding blue light and concentrating your sleep. Don't stress yourself out. You're probably going through a little bit of a phase, getting rid of toxins, inflammation. Your body's now going to heal. It could be a gut issue. D3 is also going to help with that. Get out in the sun. It's very, very important. Just don't stress and see how you go after a few weeks or a couple of months.
Yeah, great advice, guys. Appreciate that. You both are probably best experienced to answer that kind of question. I've not really gained any weight since I've been carnivore. My weight's been up and down because I'm a bodybuilder, and I know how to manipulate my weight because I just change what I eat. So my input would be very limited there. We've got another super chat, so I'll just quickly answer this one on my behalf. Thank you very much, Ben, for the second super chat you sent me. Much appreciated. High red meat consumption increases iron levels. Yes. Point of reference, I eat about 20 milligrams of iron per day from nutrition tracking software that I can work out. And sometimes it's up to about 45 milligrams. I don't have iron deficiency apart from when I'm eating too little. The amount of food that you eat in terms of the concentration of macronutrients does seem to impact my iron levels. So it doesn't seem to be true that eating, say, massive amount of food with this much iron or small amount of food with that much same amount of iron causes the same iron level in your blood. The amount of food that you take in does seem to impact your iron levels in your blood, and I've experienced this time and time again. When I'm lean, dieting down, my iron levels do always go down. So yeah, it does increase iron levels. Basically, that's my short answer. Got a question from Matthew. So thank you for joining, Matthew. Are hair mineral analysis tests more accurate than blood tests for checking certain mineral levels? We've kind of covered this already, but I'll pass it back over to Stephen just for this one, just because it is quite a quick answer you can give, because it's just covering what we said already, pretty much.
Yeah, just on the heme iron, on the iron, that was a great answer, Jonathan. You can't really overload your iron. You can't get your iron to dangerous levels with red meat with heme iron, because the body will actually clear it. The big problem with iron overload comes from supplementation and other forms of iron, normally from plants. So, right, anyway, and that's categoric. You can find that in the literature everywhere. Red meat, iron, you can't get overload. Right. Well, yes, you're right. Absolutely. What is the benefit of hair mineral analysis? We get that long term, because, like as Jonathan said, you've got the phases of the hair, 2 to 3 months, whereas red blood cells, you're getting a snapshot of white blood cells at that moment you have the blood test. So the advantage is the long term patterns, but there are other advantages like home testing rather than having to go and get your blood taken. So that sort of thing. Some people claim the hair and mineral analysis is a bit more comprehensive, but I don't agree with that. I still think it's just a lesser test to do than bloods, but you need to do a lot of bloods to get trends. So they both have their place. And I think you can, if you're running an online coaching session with a lot of clients, then it's easy to then get them all to do hair and mineral analysis and do one every sort of quarter and all that sort of stuff. So you can get some handy data. But I would say if you really want to know what's going on in your body, the best thing is the bloods compared to hair and mineral analysis. But that's how they're sold. They're sold as convenient, at home, cheap, non-invasive, pretty detailed. Whether their accuracy is there, the jury's out on that, because I've done the hair and mineral analysis as ready for a video because I thought it might be interesting, and they got two things categorically wrong, which one was that I'm not allergic to certain things and other things I'm okay with, and they got it around the wrong way. Apparently I don't do well on red meat, for instance, so take that with a pinch of salt, but that's what happened to me.
Interesting. Yeah, thanks for that. Moving to the next question. This is a yes or no answer because they've asked yes or no. Holly's Hobbies is asking iodine loading, yes or no. Phil, iodine loading, yes or no?
Again,
so if you had to do it, yes or no?
Not for me, but for some people.
Okay.
Can be.
Okay.
even really
Yeah,
high
I'd
doses.
I'd book a consult with Phil to get a more detailed answer about that one, because there's too many ins and outs, and we'll be here for about 25 minutes, probably half an hour.
There is the rough test that you can do. You can do a patch test and paint it on your skin, and if it's still there after several hours, you're probably fine. If it disappears in an hour, you're probably deficient. It's
There we
only
go.
fruit.
Yeah, there's a quick fix test, guys. What Ben said. Great shout. This is from Maya. So I can't read it. Hello, I'm eating beef and yolks only. It suits me best for my IBS. Good to hear. But I get diarrhea every time when I'm eating beef without digestive enzymes. Can digestive enzymes be taken permanently? As someone who's used them on and off for about 2 years, I'd say probably not a good idea. Best let your body do its own job, producing its own thing, doing what it does naturally. And there's always a downstream effect to these sort of things. Your body is producing all these enzymes and hormones, and the organs are running deliberately in such a way to work together. So just plugging something in with like a patch, in my opinion, doesn't really do the job. They're probably useful transitionally. I personally wouldn't use them past the point of maybe a time frame, a few weeks. I'd look at getting the result, doing some tests, maybe a liver test, gallbladder test, an ultrasound, on your gallbladder could be effective as well, and other organs. See if there's any sludge, any sort of bile acid problems, things like that. I've had these tests myself. It did resolve itself on its own. I usually just recommend to people just to play around with the fat levels, play around with the fat sources, and that seems to be what most people do. Lee, what's been your experience with digestive enzymes and things like that? Because I know it's something quite in your sort of field.
It's tricky. I haven't ever played around with them. I have had a few people in the chat, in the comments and things like that on certain videos saying that they've discovered enzymes that seem to be helping. Tammy Peterson, I think, she was saying that she had a test where she's missing a gene and she requires, can't remember, but one of the videos that I put up on Tammy Peterson, I've linked the enzyme that she used below. And so she's saying that she pretty much, this is like mandatory. If she doesn't take this, she has issues. And I think she may have similar issues in terms of like diarrhea and things like that. Really tricky. I wish I knew a little bit more to inform you better, but you might want to play around with frequency. You may want to play around with salt. You may want to play around with your fluids around meals. Again, grounding and maximizing circadian rhythm will most likely only be beneficial. It could be trial and error, but it's really tricky. I'd probably need to learn a little bit more and know a little bit more to guide you better, but that's all I can really say.
Can I have a go at this one? Can I quick go at this one?
Just a quick one, yeah. Cool.
Yeah. A lot of people have trouble with rendered fats, and that will give them diarrhea. A lot of people will maybe cook a steak and then have solid fats raw with it, like a bite of fat with it. That seems to really help with the digestion of fats and stop the runs. But quick bit of woo-woo that we don't have time to go into here, but consider contacting me or Ben about this, which is liver flushing. And, a lot in the carnivore world say it's absolute woo-woo, but I've seen it really, it can clear the sludge out of the gallbladder. It can help to free up the liver, and it can really help with digestion of fats long-term, something you do once a month. However, the only caveat to that is if you do actually have gallstones, it might be worth finding out with a quick ultrasound to see if you do have any, because then they can be shrunk down with sodiol or something before you actually go for the full liver flushing thing. But that is another option, and it can really help.
Perfect. Yeah. I've got a super chat from Rob. Thank you very much, Rob. Appreciate the super chat tonight, guys. It does help. So this is in reference to our consultation. First testosterone levels back in January were 50.3 on the scale. That's a British scale, I think. Yeah, and this March shows 22.5. Great to hear. So you've increased your testosterone levels by about a third since we've worked together. Great to hear. Much appreciated. Thank you for the super chat. It's nice to get good feedback. Now we get to the next question. I don't understand that. Can someone else interpret this? So I don't understand what he's saying. I have asked him to word things in a way I can understand, because I don't understand what the questions are most of the time.
I don't know what a swamp diet is. But I don't know. Is that just like a sad diet or something? But during carnivore, none. Some people get more plaque during the first bit of carnivore, and then it tends to go away. People have said that, and it was funny. Sally Norton was on my podcast. She was saying it can be due to oxalate dumping, and it can build up and then it disappears. I don't know. That's all I got on that.
I think actually as well, I can't remember his name, the dentist, carnivore dentist. We were talking about him the other day, Stephen. What's his name?
Kevin Smith, Dr. Kevin Smith.
Kevin Stock.
He was saying
Kevin Stock.
Yes,
Sorry,
that's it.
Yeah.
He was saying they've had a look at a lot of people that go carnivore, that they're actually consuming a lot of dairy, and that can contribute to like a lot of tartar buildup. But when they look at the health of the teeth and the gums, absolutely fine. And even some tribes and that they've seen sort of this calculus buildup, but they actually look and there's no sort of degradation of the tooth, decay and cavities and things like that. And so it's probably protective. The bodies are not an idiot, like Ken Berry would say. And so I wouldn't be too concerned with that kind of thing. Yeah.
Great stuff. This just a note that Coach Stephen Cardley made earlier about the digestive enzymes. There are contraindications, guys. We've got to bring that up, but yeah. Appreciate Stephen for mentioning that. So before you take anything, if we talk about this, that, or the other supplements, things like that, look into it yourself. If you're on a flurry of medications, just double check it, guys. We don't want people getting ill. So we'll go to the next question. Is there any research into fill in the blank carnivore? No, there's no research on the carnivore diet, except for the fact that we are hypercarnivores. That's the only research we have. If I just go around the panel quickly and just say, has your hair, or it be on your head or your body, growing quicker on the carnivore diet? Mine does seem to grow quicker on my body. What about you guys? Just say yes or no.
Yes, both.
Yes, and nails.
Yeah,
they grow quicker.
Yeah.
Nice one.
Apparently, hair and nails both grow quicker the more sex you have. So it's no.
I'm done for then. That's it.
Libido goes up.
I'm a skeleton. Could too much zinc cause copper deficiency? What are the general symptoms? Nauseousness, metallic taste in your mouth. Pretty much the same either way. You'll probably get more stomach discomfort if you have too much copper than zinc, in that it's a smaller mineral. In that it's easier to overdo it. So in comparison, when you find zinc and copper in the same formulation, it's usually about 50 milligrams of zinc to a couple of milligrams of copper. So if you go a bit too far in the copper, even by a milligram, you'll feel it more. You can get stomach discomfort and it can give you diarrhea. Have I missed anything, Stephen, in terms of like the main symptoms?
No, I'm more than happy with that answer.
Okay. Yeah, I'm sure there's more, but it's certainly possible. Right. Gents, Zbigniew, thank you very much for joining. Long-time subscriber and channel member. Gents, what do you think about today's norms using blood tests? Are they reliable? Many thanks. No. We've done this one before. We did this talk on the nutrition guidelines, Zbigniew. So if you go back a few weeks, I think this was Lee's idea. We sort of did a South Park introduction. We spoke all about it for about an hour straight, and about normative ranges and how they're not appropriate for people on the carnivore diet, and probably not for most people because, well, the ranges are based on crap science. We go straight past that one, but we have answered this one already.
Yeah, but just go and buy Stephen's book.
Yeah, get Stephen's book. Problem solved. Links to his book will be on there on the screen, theukcarnivore.com. So get Stephen's book there. How many milligrams of magnesium recommend per day for adult female? For a female, you could make a guess. Weight doesn't come into it. Age doesn't come into it, apart from in the very early stages of life and perhaps at the end of life. Magnesium recommendations are all over the shop. I'll say I've consumed as low as 200 milligrams per day for probably 4 years, the first 4 years of my carnivore diet. No symptoms of deficiency, and I have had it, like, my blood tested and serum levels tested and tissue levels tested of magnesium. So me as a big guy, 200 milligrams per day, no issues at all. I eat a bit more now because of eating more meat, not a problem. I think the recommendations are largely overstated, and you do not need a lot What I do notice, people that have enough fat in their diet tend to have better gut, therefore less intestinal permeability, therefore they don't lose as much magnesium through their feces. People can excrete too much out if they have a bad gut. I'm guessing you guys don't know the actual recommendation, but I'd guess it's somewhere between about 200 and 400 milligrams.
Yeah, I think it's about 400 milligrams.
It is. It's 400.
Okay. Are you guys happy with that, or should we move on? Or
420 if you're older. I mean, that's it. And obviously, still all the caveats: pregnancy, age. But yeah,
I think it's kind of mostly BS, like calcium and all these concerns. We get enough calcium, and yet it looks like we get hardly any. We're eating a lot of protein. We're eating a lot of the other things that help absorption, and we're not having all these other metabolites that get in the way, like oxalates that strip the calcium out of your blood and all these anti-nutrients. We're not consuming them. So, you can't look at these arbitrary average figures as like, oh, this is what you should aim for. It's like, well, we're doing it a different way. We don't need like vitamin C. It's just, we don't need the amounts that these other people obviously do need, because they're having copious amounts of sugar and glucose coming into the system.
Okay, next question from Carsten. Does someone now know their omega-6 to 3 ratio in body cells? Nobody seems to get tested. I've had it tested. Mine's actually 1-to-1, and it's happened both times I've tested it. Main reasons for that is I eat a lot of beef. Over here it is pretty much nearly entirely grass-fed. I eat a lot of fish as well, a lot more than most carnivores, and it is still 1-to-1. I don't eat pork because various different reasons, but that could come into it as well, because I don't understand the omega-3 to 6 ratio in pork. It's obviously not as bad as eating seed oils and crap, but it's not nearly as optimal. So when people say, eat beef and lamb, it's because the omega-3 to 6 ratio is a bit better, simulates a bit better, a bit more carnosine, carnitine, creatine, taurine, tyrosine, choline, all these different things. So, have you guys had your omega-3 to 6 ratio tested at all?
No.
No.
But it does mean that, if it comes to a cannibalism situation, then we should be eating Jonathan. The only problem is, first, you've got to persuade him, you've got to overpower him, which is not the easiest thing. And then secondly, there's not much bloody fat on him.
Yeah, I'm saying he's looking a bit lean at the moment.
Not very good return on investment there, fat-wise.
No, you need a lot of salt and seasonings. Oh, yeah. Yeah, there's not much on me, guys. There's not much left. All I'd say about the omega-3 to 6 ratio is don't try to go for a certain number. Like Stephen rightly said at the very start of this whole talk, go for symptoms. Try to manage your symptoms, work out how much of what you need to put in your diet to get the best outcome. There's going to be people out there that have like a 20-to-1 ratio and they feel great. There's me who feels much better in 1-to-1. So don't chase this rabbit hole, guys. It's a waste of time. You listen to your body, and if you fancy some fish and increase your omega-3, that's what I'd probably do. Right, next question. You have to add loads of butter, Jonathan. Yeah. Oh yeah. A bit like at the PHC UK, where they give us one tub, and this one guy thought he added like a vegetarian or not omnivorous option, and he thought this tub of butter was just for him, so he kept it in the corner, or like away from us all. Meanwhile, me, Ben, and Stephen were sat on the dinner with no butter in front of us. We had a lean ass steak, and the best bit of fat we had was on some duck breast. But the funny thing was, guys, with all that butter on the table, I would have had 2 times the amount of that with one meal in that pot that was to share for the whole table if I wasn't dieting. Weird. Great to sit down and chat with Ben, Richard and Sylvie at the weekend. Shame the rest of you guys weren't there. I was there. And I was with them, or one of them, for the most of the time. Yeah. Stephen was there as well. It was very obvious. I was glaringly obviously there, wearing bright clothing. 6'1", tan bodybuilder. I don't know how you guys didn't see me. I didn't know how you didn't see Stephen either. I don't know. Anyway.
Thanks for booking. It's coming with Mark, isn't it? So yeah, that was great.
Yeah, brilliant. Look forward to meeting you there.
Stephen, John, do you remember the Medichecks testing site that well?
Mm-hmm.
Which was the most comprehensive? The most comprehensive one, Rob, is obviously the most expensive one. It's about 200 quid or something. It tests something like 70 different markers, I think. 53 to 70, I can't remember. I looked recently. But Stephen, is there one specifically you'd go for?
Well, I'm going to answer his question as put. Yeah, the most comprehensive one will be the best one if you can afford it, because one of the things I find, if you go for a sort of targeted one, it's too targeted, and you say, I often used to say to people, "Oh, I wish we'd got that test and that test." So I became a little bit more forward and said, "Really, you're going to regret not going for the one you can afford, the top one you can afford." So yeah, that's the best thing to do. And actually, he's a client of yours, isn't he, Jonathan? Rabbi Rob, is he a client of yours?
Yeah, Rabbi Rob, yeah.
Yeah, I mean, if you have a coaching session with him and he's got a particular thing, then I can tell him what particular tests to get. So we can do that. I don't mind helping your client there. The other thing is, talk about bloods. My book is on Audible as well. So it's an audio book if you want, or it's on Amazon as a paperback. Yeah, I know Amazon, I hate them, but there you go. Apple, it's there. So you can either get it as an ebook from my store direct, and the big corporate giants don't get their grubby paws on it, or you can get it from Amazon. I haven't got the facility to make it as a paperback, or not one that's affordable. So sadly, Amazon's best for paperback. You've got Apple as well, and like I say, audiobook. It was out today actually. Well, there you go. All about bloods.
Yeah, how much is that, Stephen? I might check that one out.
Well, locally it's less than $10 as an ebook. And then on Amazon and Apple, it's I don't know, about 12, 13 quid, something like that. It's not a lot of money for what you get.
Yes, it sounds like a good investment, actually. So, guys, if you're watching this now, check it out. It's available on the things I've just put on the screen there, so you'll find it under his links as well in his YouTube and websites. Right. How much butter do you all eat? Barely any. Right now, barely any, but I've eaten up to 2 bricks of butter per day for months and months on end. What about you guys? If we go for it, that's 250 grams. So that's what we call a brick of butter, guys, not a stick, a brick. 250. Yeah.
I don't eat that much. I eat about 10% of that.
Yeah, I've gone off dairy a lot actually. I used to have a lot. Used to drink coffee as well, but yeah, really just very rarely now.
Like tallow.
For me, almost none. Once now and again, if you go to a restaurant, the steak's not fatty enough, you'll get a bit of that. But with anything autoimmune, any dairy is not a good idea. Even butter, sadly, because anything fried in butter is really nice, or with butter on it. So, shame. But no, I swap it out for tallow pretty much.
Yeah, all depends on the day for me. I just basically eat intuitively. If I've got egg yolks or enough fat on the meat, I don't even touch eggs. So sometimes I just eat red meat. Sometimes I add egg yolks. Sometimes, if I've got, say, duck legs occasionally, just a fancy duck legs, or a bit of lean beef that I've got, then I might add some butter. But I'm not weighing any of this stuff. I pretty much just listen to my body. Sometimes I finish with butter. Sometimes I start with butter. Sometimes I'm dipping it in the butter. All sorts. So.
Yeah. We've got one more question, so this will be the last one I'm about to read out. I just want to quickly say that I was at the lunch, I think it was on Sunday, maybe Sunday, with Andrew Scarborough. He obviously got a double portion of meat and I had a half portion. That's how it goes. And I actually stole him loads of pats of butter because he needed more fat for his ketogenic sort of style approach to dieting. So he had about 8 to 10 little pats of butter. And I obviously had 0, I think. But yeah, they don't give you much, guys. But never mind, eh?
Andrew is watching, by the way. He's just commented.
Oh, nice. Yeah.
See? Andrew, you're eating butter.
There you go.
Surprise.
Yeah, he eats butter, yeah, sometimes. So the next question is, does 1 gram per kilo body weight of protein refer to amount of meat or amount of protein in the meat, as meat is roughly... It's 1 gram of protein per... I don't have this recommendation, so I don't know who said this because it's way too little. It's absurdly too little.
I think they've got that wrong. The standard sort of thing people say, and it is, something that is a good starting point. Yes, per pound. 1 gram of protein per pound of lean body mass that you want. And obviously, if you're doing it in kilograms, then you take 1 and times it by 2.2. So it's 2.2 grams of protein per kilogram of lean body mass. So if you weigh 300 pounds and you want to weigh 200 pounds, and then you work out on the 200 pounds. But the question about the meat, it's not the weight of meat, no, it's the amount of protein. So you're right, actually. If you have a 400 gram ribeye, then roughly speaking 100 grams of that is protein.
Yeah, and that's cooked weight, guys. So for example, if you have a pack of mince, it's a 500 gram pack of mince, that will be about 100 grams of protein. Once you cook it, you lose about 20 to 25% water moisture content of that. Some fat will render it off, but you also add it back into the food that you're eating. So yeah, it works out cooked weight, about 25% of cooked weight of meat, give or take, depending what meat it is, tends to be the protein content. So 400 grams of cooked ribeye, for example, will be about 100 grams of protein, something like that. But yeah, in science, we tend to use grams per kilo of body weight. And if you're a bit more savvy, I'd say use grams per kilo of lean body weight. A person weighing 400 pounds of muscle and a person weighing 400 grams of pounds of fat will have a different protein requirement. So I'm a bit more precise, but obviously I'm in body composition. That's my forte, my thing. So I work a little bit more closely with people who are a bit more accurate, but largely speaking, if you're an average body weight, average body fat kind of person, it doesn't really matter too much. But do you guys want to end with any closing thoughts before we wrap up? Because we've got through all the questions now, which is brilliant. Giving people lots of value. We've had lots of super chats, and we just appreciate everyone joining. So if anyone's got any last words on the panel, just speak now, forever hold your peace.
I've got a quick closing one, just because when Ben turned up, he sent me a message while we were talking, and we've just sold 3 rooms for Spain today. And so if anybody's into coming along, we've had a bit of a rush on those, and there's only 7 rooms and 2 yurts left. So go to thebigfatchallenge.com and you'll see, the little button at the top, you can click where the event is there, and all the details and everything there. Come and join us. Anthony Chafee's there. Sophia Clements is going to be there, and Natasha Campbell McBride as well, and maybe a couple of other surprises. But if you're thinking about booking a room, stop hovering, because they're going. That's my closing thought.
Well, nice one, guys. I'll wrap it up there. Thank you very much for joining, everyone. And if you want to follow us, people always ask, how do I find whoever's on the screen? Well, it's on the screen now. I'm Carnivore Muscle. You'll find me on my channel there. Ben Hunt, affiliated with Phil Escott. They're from thebigfatchallenge.com. Lee Coppus is from Kent Carnivore, not Jordan Peterson. Coach Stephen you'll find at theukcarnivore.com. You'll also find him on his YouTube channel, which is there. And feel free to subscribe to us, follow us, and buy any of our merchandise. Stephen and I both offer beautifully branded merchandise, which includes, I think, mugs and hats and cups and t-shirts and stuff. So yeah, appreciate you joining tonight, and thank you very much again for the super chats. Have a good evening.